Hello, everyone. It's Friday, June the 26th, and I've got a lot to go over with you today. We've just had some really productive meetings with the House and the Senate and representation, from both sides of the aisle. It was really, really good. I'm sorry it ran over, but it just did. I've got to, I'm going to try to go through the updates pretty quickly. But I always want to start with just this. Good news today, no additional deaths since Wednesday. That's good stuff. That we still have lost 92 great West Virginians. Please keep them in your thoughts and prayers and just remember them and their families and all their loved ones. This is week 9 of the West Virginia Strong, the comeback reopening plan. Our guidance and documents are up, up on the website. But before I go any further, I want to address this. I want to address it just straight up and everything. Yesterday we accepted Dr. Kathy Slimp's resignation. To just tell it just straight up like it is, numerous things have led me all along the way to believe that my confidence level just evaporated, and so, I felt like that Dr. Slimp's a good person, and I know she's done some good work, and we're very proud of her in this pandemic. This is a great, big task, and there's lots of moving parts. And from the standpoint of what you expect from me, you expect results. You don't expect just kindness and effort. You expect results, and that's what I'm going to deliver to you. And so from that standpoint, I had lost confidence. There's no point in belaboring that, but many different incidences. The other thing I want to tell you is, unfortunately, in lots of ways, it's a campaign season. It's a political season, and so there's a lot of attention that is drawn, and there's a lot of wannabes that come up with, ideas and everything, and say, and the wannabes have come out recently and said, well, what the Justice Administration is doing is they are deflating the positive test that we have in order to make ourselves look better. And that's so ridiculous. I mean, that is just so false and so ridiculous. But that's the thing. I guess this day and time, anybody can say anything. The biggest lies that you want to come up with, they come up with the biggest lies, and so, but that's so wrong. The bottom line is just this: if in fact we had deflated the number of positives, we'd be overrun at our hospitals, would we not? I mean, really and truly, at the end of the day, it just teetotally is an effort to undermine all the good work that people are doing every day. Do you realize in West Virginia, the state of West Virginia, I think on day before yesterday, we had 66 total people in the hospital from the COVID situation. 66. And all of our hospitals combined. And in addition to that, we had 4 people on ventilators day before yesterday, I think. I think that's correct. Now, if we had deflated the positives, we'd have more and more people. We'd have what's going on in Florida or Texas or Arizona or whatever. That's not the case. Now, the case is just one thing, and it's dead the opposite. If, in fact, what has happened, and we're digging, but we have every reason right now to believe that we just stumbled and bumbled along all over ourselves and everything, and that's what I can't stand. I can't stand the stumbling and the bumbling. But really and truly, what happened is we inflated the amount of our active cases, meaning we were telling you that we still had more people sick than we do have, and so we're getting to the bottom of that. We'll give you more accurate numbers later on. To be perfectly honest, it's great. It's great from the standpoint that we don't have as many people sick, but it's terrible from the standpoint if we can't keep up with the numbers. Now, I'm going to go quickly from here. I'm going to tell you the Myrtle Beach outbreak continues. Now we have 18 counties. Of course, we're probably going to end up with 55 counties because everybody loves Myrtle Beach, and all I can say to you over and over and over is, if you've gone to Myrtle Beach, get tested. If you can think about it just a little bit, and maybe there's another choice, and I don't want to run people away from Myrtle Beach. It's a great place, but we have now more than 100 cases, 100 cases that have come back from Myrtle Beach and everything. So I strongly urge you again about wearing your mask, and absolutely, especially if you were having to go into a crowded situation at Myrtle Beach or wherever it may be, but I expect you to wear your mask, or I ask you to in every way, if you go into buildings in West Virginia as well. The church outbreak, there's no additional churches that we have an outbreak in. We still have 3 active in Ohio, Greenbrier, and Boone County, and we're watching this, and I do the same thing, the pew in between. We got to have that. We got to have social distancing. We got to have masks when you're in the church. So please, please, please do that. We got free testing today in Cabell, Hancock, Mingo, and Randolph counties. Tomorrow we'll be in McDowell, and next Monday we'll be in Lincoln. Take advantage of that, especially our minorities or all of our vulnerable people. Please take advantage of it. I'll get into the stuff on our cities and counties. Now we have reimbursements awarded of $16 million plus dollars and everything, 140 applicants so far. We want everybody, all cities and all counties to apply. I'll get into more about that in just a second. The summer feeding program, the 690 sites now that we have, and if you have any issue on where to get food that you can't determine where the place to go, call 211 and we'll help you. On our jail update, we now have a total of 3, and this really upsets me, but 3 active COVID cases in 1 prison, and that's in Huttonsville. We have been reporting that to you inaccurately, and there's just no excuse for that. But from the standpoint of the census, I want you to remember the census and everything and get counted. Tremendously important. And from the Higher Ed Policy Commission, I want to congratulate in every way Dr. Sarah Armstrong Tucker. She is now our new counselor, commissioner, and new counselor of higher ed. So congratulations, Sarah. Now, I told you, I promised you at the end of the week today that I would give you a rundown on all the economics of our state. Now, this is going to take just a second, so bear with me. But if we go back we go back 12 months ago. We began what is our fiscal year 2020. It began last June. And last July 1st. Now, and it runs through this June the 30th. Now, when we had just come off a year that we had produced record surpluses beyond belief, in the 2019 year, we produced record surpluses of $511 million, which was equivalent to what we had produced in the last 10 years. We produced it in 1 year. Now, so when we did that, we spun that budget level into 2020. So in 2020, for us to have met the budget in 2020, we would have had to have one heck of a good year. We started off the year rough. We came right out of the box in July, and we had a 32.4 or something like that, right at $33 million hole in the bucket. Well, we were worried. And then all of a sudden, August came in at another $33 million hole in the bucket. And we had $66 million that we were upside down in the first 2 months of the year. And so we had to contemplate cuts. And we had to contemplate cutting into a lot of different people. My revenue people said, hold on, Governor, let's just wait until we get September in, which will be the last month in the first quarter of the year. Well, September had a lot of promise, and then all of a sudden it started to wane as well. We watch it every day, every single day. And so as September waned, and it came in about a $6 or $7 million to the good, if I remember correctly, and I could be a little off in my numbers. But as September came in, nowhere close to as good as what we had hoped, we knew we had a real problem, so we had to start moving right in to make real plans to make those cuts. I kept trying to hold my hands on the reins and hold back because I didn't want to make the cuts. I didn't want to hurt people in any way if we could prevent it. And now October, November, and December have come in, and we're a little bit better. And we're still holding the reins and saying we're not going to make these cuts if we don't have to make them. And then January and February came in, and we were a little bit better. So now we're at the point in time where we absolutely know we're probably not going to have to make the cuts. And then March, right before this COVID situation really grabbed us, March really came in pretty decent because all the stuff was already baked, all the cake was already done. And we were within $6 million of being our head above water from 66 million down. And then all of a sudden, April rolled in at a $192 million deficit because of the COVID situation, plus the fact that we moved the income tax filing date from April 15th to July 15th. We had a tremendous deficit at that point in time. And at that point in time, my revenue people told me, probably, Governor, you can probably forecast at this point in time a $525 million deficit. It was really, really difficult. And we had to try to figure out what in the world to do. Now, from all of that, we had monies available to us and everything in reserve accounts. We took those because we had to take those, at that point in time to have available cash and keep our head above water. We had an increase in the matching dollars on Medicaid from the federal government that we knew were backfilling those dollars as we went. We kept moving the numbers as best we possibly could, and all of a sudden, we started to reopen, and I'll never forget this call one night, probably about 10:30 or 11 o'clock. Bray Carey and I were talking on the phone, and Bray said, Governor, can you believe this? Can you believe these numbers keep coming in better? These numbers, Governor, are coming in like you thought they were going to come in. Can you believe that? Can you really believe that this reopening that we're doing is producing these kind of numbers? And I said, Bray, now I'll never forget this. I said, Bray, I've known this all along, and I've just not told anyone hardly. But you see, West Virginia, you never really closed. You never really closed, and the economic numbers had to continue to be better than what we thought. What we did is we closed everything to protect you, and we did that, and yet we kept our essentials running. We closed our schools, we closed our bars, we closed our restaurants, we closed the government, we closed all, the hair salons and the barbershops and places where we knew you would be in close contact with one another. We closed our big gatherings. We closed the state tournament. We closed all the things that we knew were important to protect you. But I knew all along that the engine was still running. Now, that $525 million deficit is now down to $285 million. The reserve funds that we have, we're going to have plenty of cash to go out through the end of the year, no problem. No problem whatsoever. And the amazing thing that you'll find is just this, is the reserve funds that we use cash to go down have now, by June the 30th, have now been completely, totally replenished. Now, how's that possible? And it's possible through the federal grant that is the federal match that is out there right now in regard to Medicaid. So what we've done is we've used our reserves We have, not rainy day, and we have replaced our reserves 100%. And the other thing we have done is we have basically replenished dollars that we were allowed to turn in by the guidelines. We have replenished those dollars, and lo and behold, we're going to run across the finish line on June 30th with a surplus. It's not going to be much. It's only going to be probably about, less than $10 million. But absolutely, we're going to go across the finish line with a surplus in a year that our experts predicted we were going to be $525 million upside down. Now, that's not all. In addition to that, we have CARES money, and we have other grant monies that have come into West Virginia. And we've got to find the right and the appropriate places to put them. Jordan, if you could put the slide up that shows in excess of $2.2 billion. This slide is this. There is $1.25 billion that has come into West Virginia, and it's in a bucket. In addition to that, there is to date $970,811,611.79 that is in additional grants that is come in or is going directly to West Virginians. Now, working those grants and finding how to put stuff into those buckets, there's many different ways that can be. For health departments, for broadband, for all kinds of different things. One of the things that we found that we can use in those grant buckets is just this: the ability to give you the assurance that if we have another outbreak, another pandemic, we're prepared. And how we're prepared is through the National Guard and WVU. We have now been able to set aside dollars and set up real live manufacturing to have millions, if be the case, millions of masks and gowns and all kinds of different things to be able to protect you if, in fact, God forbid, that there's another level of pandemic. So what we have done is we have now got a situation to where we can assure you that if we're not going to get in a situation going down the road where we're caught without the correct protective equipment to be able to protect you and protect our healthcare communities. So I would say just this to all West Virginians: to any of you that don't understand all the buckets, contact your representatives. They're now going to have all the different buckets and everything, and they'll be working them in every way possible to find out what ways that we can, fit you into different grant buckets, and in order to be able to facilitate more and more abilities and dollars into West Virginia. Three of the big areas of the $970 million are hospitals. Our rural hospitals getting a ton of money. In addition to that, or getting dollars to hopefully help our rural hospital system. Our higher ed, there's a bunch of money set aside for higher ed, and there's a bunch of money set aside for K through 12. So that's really all great stuff. Now, I want to talk about, from that side, the administering of that side is kind of out of my bailiwick. The administering for that side really comes from the federal government side. Now, from the side that I am in charge of is the $1.25 billion that's sitting there, and it's sitting there to be able to do lots of different stuff with it. Now, I'm going to tell you what we're going to do with those dollars and everything. But if you could put that slide up, please. If you'll look here on the amount of dollars that we have had requested thus far from the counties and the cities, it looks to us, to the best of our abilities, it looks to us that throughout, between now and December the 30th, by the guidelines that the federal government has given us, that what we will be sending to the counties and the cities, by budgeting what they have requested and what looks like will fall in the guidelines, is $200 million. Now, I'll get to the small businesses in just a second. There's $10 million that's going to the Fairmont Hospital. It's already gone to the Fairmont Hospital because we established a northern and a southern. We did Thomas, and we did the same thing in the northern end. We were going to prepare Fairmont in case we had an outbreak, and it will be prepared in case we have a big-time outbreak, as Thomas was down here. You know, we're going to put $100 million immediately into additional paving and working on our highways to be able, and we've classified a lot of our highway stuff as COVID-related highway work, and by doing that, we're able to move some dollars that we have dedicated to those roads over into doing other roads within West Virginia. But these roads, the highway department's done a lot of great work. You know, our Secretary Bird White and our Deputy Secretary Jimmy Richland and all of his group have done great work in identifying roads that really and truly are very, very important to the public to be able to get to hospitals and to get to, to quality medical care and everything, to be able to assist and help you to where we've got to fix these roads to be able to do just that, to make the ease of taking care of the potential pandemic, and that's what the dollars are there for. We've vetted it in every way possible through all kinds of different, all of our attorneys and everything. We can do that. From the locals, the public service districts and everything, they're having trouble collecting some dollars, and they're working with people and everything on their water bills and things like that. We've got some extra money that we're going to put over to them and everything to assure that their safekeeping in our public service districts are well taken care of. Now, in addition to that, we have two areas that are just basically paybacks for money that we spent from the governor's contingency fund and everything, like where we bought all these masks, where we ran out and bought all the masks and everything we could find all over the world and stuff like that. And all that is a reimbursement. And from the standpoint of the state has spent $57 million on stuff, that is just a straight pass-through reimbursement back to them. Now, the last two lines are monstrously important. And the reason that they are monstrously important is just this, is those two lines, we have to ensure the solvency of our unemployment fund. And from the standpoint of Workforce West Virginia, we have set aside $287 million and $400 million. The $287 million is dollars that we had in place, and now we've drained the fund dry. And the $400 million is for future claims between now and December 30th. We can do exactly just that. Now, and if we don't do that, and do that just this way, here's what's going to happen. We're going to probably have our bonds derated. In addition to all that, we're going to have to significantly raise, the taxes on our businesses in regard to unemployment. And this move right here ensures that we're not going to raise those taxes. We're not. We're absolutely not going to raise the taxes, and this is exactly the prudent plan to be able to keep our businesses working in this state and thriving and moving forward, and our fund reestablished and everything to where we do not have to raise those taxes, and moving forward, there may be even some better stuff come than exists today as far as the taxation on our businesses. So that's really basically it. The bottom line is here's how we're moving with the $1.25 billion. There's another $5 million left here. but that's how we're moving with the $1.25 billion. The grants are $970 million that is on top of this, and the grants we're working from the standpoint of broadband and whatever it may be, and it may very well be, and everyone needs to understand this, it may very well be that the last two lines, the 287 and the 400, may very well be forgiven from the standpoint of the government and spend right back to us, and then we'll have more dollars to be more aggressive in broadband or whatever it may be that can help our people in this state. Now, this is a plan, and from the standpoint of the year we're in, it's worked. I told you it was going to work. Now, but I'm going to tell you how we're going to make it just one step better. From the small businesses that are up there, what we're going to do is we have identified in the state of West Virginia 15,000 small businesses that are employing between 5 and 35 people. You see, if we take care of a bigger business and we send a bigger business and you know, let's say a manufacturing business or a mining business or whatever like that, we send them $25,000 or $50,000, it'll get lost like instantly. But our small businesses, the ones that are employing 5 to 35 people, they are the backbone of everything we do in this state. And if we're able to help them and reward them and keep them going in a really positive way, more power to us. Now, we can't send them all the money in the world, but we've dedicated $150 million. And what we're hoping to do is have them apply, and as they apply, the grant that will be granted directly to them with very, very few strings attached will be $10,000. So what we're wanting to do is grant to 15,000 small businesses that have employees from 5 to 35 on a needs-based. We have to have needs-based. So you have to, when you apply, and we'll be giving you all that, and that'll be coming out really, really soon. But basically, we'll be able to pump out $150 million to our small businesses, and it's all going to the smallest businesses. So it'll be going out in $10,000 tranches, and we hope it goes to 15,000 businesses, and therefore it'll be $150 million. Now, I'm going to end by just telling you just this. Hang tight with me just a second. Well, okay. I've given you a lot of good news. I've given you news that the year that we're in right now, that we're ending the 30th of this month, next Tuesday, we're okay. In fact, we're going to turn out a surplus. You know, in a year that looked like chaos beyond chaos. From a cash standpoint, we're going to turn out a surplus. You know, we bled down some reserve funds without going to rainy day, and in addition to that, now we've replaced them in entirety. It is amazing, but it is not any more amazing than what West Virginians have done in every way. 92 deaths, a cumulative percentage of 1.68. You're knocking it out of the park, West Virginia, and you're doing it very, very, very well. In addition to that now, I am telling you that the federal government is giving us grants of $970 million, and there's an additional $1.25 billion of CARES money, and I've told you how that we're going to plan to spend it. We're going to give $200 million to the cities, and we're going to give, and the counties, we're going to give $150 million to our small businesses and those people from 5 to 35, a little bit to Fairmont, a little bit on highways, a little bit to public service, a little bit on reimbursement, and then we're going to park. We're going to park $687 million for our unemployment funds to ensure beyond any doubt that we will not have to raise taxes on our businesses. Now, so the whole deal is just all that except one more thing. One more thing, and that is just this. There are 4 other real positive surprises that are coming to West Virginia. The first real positive surprise is this. We moved our income tax filing date from April 15th to July 15th. Now, in July, beginning the new year, we will get a substantial uptick in dollars that will come in the new year. That will jumpstart us and significantly help us right out of the get-go. In addition to that, I truly believe in the month of July, you will have a 4th additional stimulus, federal government additional stimulus package. I don't have any idea if it will be state-related or it will be individually related or whatever. I truly believe there'll be payments to people to encourage them to get back to work. And I celebrate, any kind of level of payments that we can get to West Virginians to help them. I love it. But from the standpoint of other things, there may be additional state dollars or there may be additional, grants. But I truly believe there's going to be additional dollars coming to West Virginia in the last stimulus package that will be out somewhere close to the end of July. In addition to that, I am very, very hopeful, in regard to the monies that we parked, on unemployment, that we'll have a good result there, and there may be dollars that will come back in the CARES thing that will be dollars that we can spend there as well. And the last thing I would tell you is just this. The revenue replacement issue has not gone away. It's not died completely, and it's still out there, and I do believe there'll be more opportunities for West Virginia there. Now, the net of the whole thing is just this. West Virginia, you have absolutely done so good. We're going to be fine economically. I've told you over and over and over, you keep doing the great work you do. You are the best of the best. That's all there is to it. You are the diamond in the rough everybody missed. You keep doing it. We'll do our job here, and hopefully we'll push the right buttons at the right time. It's a tough job, and there's lots and lots of buttons to push and a lot of moving parts, but we'll continue to try to do the best we possibly can for you every day, because not only that, you have been the miracle. You have absolutely pulled off what nobody could ever have done. Other states are reeling in every direction. Other states are pausing. Other states are concerned and just so many different things. Other states are economically coming apart at the seams. But not you, West Virginia. You're not backing up. You never have. And absolutely, I am so proud of you, it's unbelievable. We're going to be just fine, West Virginia. Keep doing the good work.
All right, thank you, Governor. Let's first go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. National Guard personnel continue to support debris removal operations in Alderson, and we'll work through the weekend on that initiative, and then into next week we'll begin a follow-up in support of Fayette County Emergency Management. As the governor pointed out, a significant number of testing lanes going on over the next several days, which we're engaged in supporting our local and state partners with. Just want to highlight that as of today, we've pushed out over 4 million pieces of PPE across the state during this time frame in support of a variety of different organizations working closely with the DHHR and Homeland Security team in that regard. And as of this weekend, the lanes we have supported for testing will go over approximately 20,000 West Virginians who've gone through those lanes. A great testament. And I'd just like to reinforce on behalf of all the Guard personnel have been working this effort in support of our various partners. As the governor points out, we're doing great, but we would ask that you continue when you're out in public to wear appropriate, stay distance, as well as wear masks where appropriate so that we can stay on this track and continue to move forward. Thank you.
All right, thank you, General. Next, we'll go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon. It's a pleasure to be with everybody this afternoon. A lot of people are looking at the national news and seeing that we're having a spike in coronavirus infections across our country. We had the highest total number of positive tests yesterday since the coronavirus pandemic has been going on in the United States. But I want to make sure that we reassure our citizens in West Virginia that we are still doing well. It's not that we can become complacent, and the governor has mentioned many of the episodes that we have seen, whether it be in church outbreaks or people traveling to places of more activity and then coming back to West Virginia. But as we look at the total portfolio of the details, the information that we assess, we know that our RT value, our reproductive number, is over 1, so that we do know there is some activity in the state of West Virginia. But when we look at the other data, including the daily positive conversion rate of total tests to positive tests, as we look at hospitalization admissions related to COVID or suspected COVID, or we look at ICU admissions or ventilator use for COVID, and when we look at the number of active cases, as we are looking at data that we are also getting from local health departments, we feel very comfortable that the state of West Virginia is still doing well. However, as the governor has said many times, as all of the health folks have said too, we need to continue to be quite diligent and vigilant around wearing masks and staying physically distanced, wearing the face coverings when you get out in public. Remember, the face covering protects other people from the droplets that you might produce. Cover your coughs or your sneezes with the crook of your elbow or your shoulder, and make sure you wash your hands. And when you're out and wear your face mask, make sure it's up over your nose and your mouth. If we continue to do this, we will continue to do great and protect the vulnerable citizens of West Virginia and our healthcare assets, but also we will also be able to sustain our economic future and continue to open the vital businesses and the things that we love to do. So thank you very much.
All right, thank you, Dr. Marsh. Secretary Bill Crouch from the West Virginia DHHR is also joining us today and is available for questions. Once again, we're holding today's briefing with media members joining us virtually to practice good social distancing. The first questioner today is Brad McElhenney with West Virginia Metro.
Hi, Governor. You're talking about moving money around to meet the budget and also allocation of $1.25 billion. Wondering how you might do that without the direct involvement of the legislature.
Brad, I guess the easiest way for me to answer that would probably be, let my general counsel, give you that answer. But we have, we have absolutely vetted this from end to end, and I think the federal government's directive is for me to administer this and to do this, and I would always welcome the help and everything, welcome everybody involved in everything in every way. But I'm gonna bring Brian up and let Brian, talk to you just 1 second too. You maybe want to get him. Yeah. The bottom line, Brad, as you're going is these Fed dollars are not in our budget, but go ahead.
Okay. So thanks, Brad, for that question. We had some consultants do the work, and they came back with a legal opinion that The current budget bill prospectively does include federal dollars received after the legislature meets. We believe these funds would be incorporated within that. Additionally, again, this money was granted during an emergency, and it is contemplated that the governor has the authority to spend those emergency funds both federally and on a state basis.
All right, thank you, Brad. Next, we'll go to Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass with Channel 8 and Fox 11 in Charleston. Governor, I'd asked you a question about Kanawha County's request for $10 million to help small businesses. You've now outlined your plan that would help small businesses across the state with additional money for local governments. Can you dive into the local government part of it a little bit and delineate what you'll be, at least a rough sketch if you don't have the detailed plan, what you'll be sending out to local governments? Will it be by size? Will it be by request? Will it be by cost? How will that work?
Kenny, we're getting in, they're following, the website that we have and following that protocol, and we're getting in those applications nonstop. But the size naturally will have a gigantically big, wide range and everything because, cities like, Morgantown or Martinsburg or Charleston or Huntington or whatever like that, their applications will be significantly higher and everything. But we're just processing those applications as they come in and following the rules that we got to go by, having a lot of communications with the people and being really careful that we do it the right way.
All right, thank you, Kenny. Next, we'll go to Annie Moore with WVVA.
We're hearing from nursing homes about this practice of using 3 tests to confirm a COVID diagnosis. Is this the standard of practice across the state? And how do you rule out the possibility that the person could have cleared the virus after the first test?
Clay, you're going to have to answer that, sir, or Bill Crouch, one of the two.
Bill, maybe you can answer. I'm not familiar with the 3 tests for a patient.
Yes, absolutely. Thank you, Governor. Thank you for the question. I think this might have to do with a false negative or a false positive test. We've had some false positives in nursing homes throughout the state, and yet for whatever reason, a good example might be when there were no visitors into the facility and the staff all tested normal, and yet there was a positive test for a patient. Then there was a reason to repeat that test. And many times what happens is that test comes back negative, but then to make absolutely sure a third test is done at the state lab to rule out positive COVID patients. So I suspect that's what you're referring to.
But Bill, if I could just add one quick thing. I don't think there's any protocol that would make a single person need to get 3 separate tests. It would be to validate a finding that would be unusual and wanting to be verified. Correct, Bill?
That is correct. Thank you, Clay. I wasn't sure I was muted there. Thank you.
All right, thank you, Annie. Next, we'll go to Steve Adams with Ogden Newspapers.
Yeah, Steve Adams, Ogden Newspapers here. Obviously, with the resignation of Dr. Slemp, that means we're out without a state health officer and a commissioner for the Bureau of Public Health, particularly at a time when we really kind of need somebody at the helm there. Do we have somebody in mind, or are we immediately going into a search function? And how's the office functioning currently without somebody in that top position? I know that obviously beyond COVID, that office has a lot of responsibilities, especially involving our opioid crisis. Can someone talk about that, please? Thank you.
I can address that, Stephen. We'll be filling that position ASAP. It will not be long at all. We interviewed a person, I think, yesterday. We're working that, and we've got plenty of support people in place to be able to handle the situation that we've got right now.
All right, thank you, Steve. Next, we'll go to Taylor Stuck with the Herald-Dispatch.
Hi all, it's Taylor at the Herald-Dispatch. I have a question about getting tested if you do go to Myrtle Beach or travel pretty much anywhere. If you come back home and you don't have one of these like free testing sites like Cabell County is having this weekend, where do you go to get tested? And I'm still hearing there are health departments, that you have to have symptoms still to get tested. So where should you go if you're traveling?
Bill or Clay, one of you guys. That's y'all's question.
Yeah. First place to go, yes, thank you, Governor, and thank you for the question. The first place to go is your family, your primary physician, your family physician, if you have a need to get tested. CDC guidelines still, for some physicians, are that you must have symptoms. So we've experienced a situation where individuals do come back and physicians do not wish to test those patients. So you may then go to the local health department and see if that's a possibility, or look at what the governor puts up every day in terms of our free testing sites. So if everything else fails, contact the state health department. We'll see if we can help get you tested. Thank you.
All right, thank you, Taylor. Next, we'll go to Mark Curtis with Next Star Media.
Good afternoon, Governor and cabinet members. Governor, the Reverend Matthew Watts he's a big civil rights advocate in the state and represents not only the minority community, but a lot of churches around the state, both majority and minority churches. He is concerned that 20% of the people in this state live under the federal poverty level, and he doesn't see enough money going to them. He'd like to see upwards of $250 million just to target the most impoverished communities in our state under the Federal CARES Act. Your thoughts?
Well, Mark, I just to tell it like it is, I do not think the CARES Act, the CARES Act dollars allowed for that. There are specific things that you have to do to qualify for the CARES Act dollars. I am genuinely concerned, about his concerns. And I want things to be better and better and better for all. From the standpoint of just what we're just doing, with the 15,000 different businesses, to be able to send dollars out to those 15,000 different businesses, small businesses and everything, hopefully can help lots and lots of different people. But there's one other thing that we're doing is the public service dollars. Did you see, in the CARES, $25 million we put over toward public service? And the reason we did is a bunch of people are not able to pay their water bills. And so as they're not able to pay their water bills, we're going to backfill the public service to be able to help them get through their time of not being able to collect these dollars and still not cut people's water off. So there's all kinds of things that we're trying to do. And as we go forward, we're just going to keep on doing everything we possibly can. Within the grants, there's more and more and more dollars that are in the grants that are able to funnel directly into communities like what you're talking about and everything. But we need to just keep trying to do more. And I'm sure there's a whole lot more that we can do within our minority communities as well as others.
All right, thank you, Mark. Next, we'll go to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. As I looked at your chart about allocations, I did not see a mention of education. Is that to mean that education did not cost more in the pandemic and will not cost more to plan for a potential return to a pandemic in 2021?
No, sir. There is enormous amounts of money in the grant side, in the $970 million side that's going to education. And if I remember correctly, it's in the $80 million plus dollars that's going to higher ed, and an equivalent amount, and I could be wrong, so don't hold me directly to this, going to K through 12. But nevertheless, whatever it is, there's major money that's going to education.
All right, thank you, Paul. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, you said we're still getting to the bottom of our number discrepancy. Could you be specific about what we're looking at?
Charles, I can, but I don't want to be. I don't want to be completely specific. But the best case that I could give you is just this. And we think there's multiple of this. In fact, we don't think, we know there's multiple of this. But at Huttonsville, we had an outbreak. And the outbreak, if I remember correctly, ran up to almost 120 different people that were at Huttonsville. Maybe it was even higher than that. And they were classified instantly as active. And so now, we worked those, and people were getting better all the time, and that number was coming down. But yet, we just dropped the ball, and we did not reflect that number being down. And so basically then what we've done is we are telling you we've got a whole lot more sick people than we really have. We're sending out news that is completely in the opposite of the good news that we'd like to send out. So the long and the short of it is, this is like me saying to you, I'll give you $2,000 for your car, and you say, well, no, I'd like to have $1,500, and me saying, well, I'll give you $4,000. And that's just how silly or wrong it is. We basically inflated by not taking them, we didn't inflate, but by not taking them off the list when they got well, it inflated our active case numbers. And to be perfectly honest, we're working that like crazy. We'll probably, on Monday, we'll have accurate numbers for you and everything, but they are significant.
All right, thank you. Next, we'll go to David Beard. David Beard with the Dominion Post. I think you may still be muted. Okay, next let's go to Dave Mistich with West Virginia Public Broadcasting. Dave?
Hey, Governor. My question is about this this travel, the self-quarantine directive that you had put in place for people traveling in from out of states. I believe that that's since been lifted. With this new spike in cases around the country and even here, is there any thought to re-implement that 14-day self-quarantine directive?
It's always a possibility. Don't get me wrong, we're all concerned all the time. But it was lifted, and really and truly all we're doing is continuing to watch the numbers. We're going to watch the numbers, listen to people and everything. If indeed we need to put that back on, we'll put it back on. Right now we don't see a need to put it back on, but we're always concerned and always watching.
All right, Governor, I'll turn it back to you.
Okay, we've covered a lot of stuff. I hope that you better understand the things that I work with every day, and a lot of great people here have done a lot of great work. I want to tell you again that things are a little difficult in all this to understand, but I want to tell you that there's, in the grants, in these federal dollars, there's dollars in this, significant dollars for Medicaid and child care and health care and our foster care and our SNAP programs and food assistance. There are dollars in all of the grants in all kinds of different ways. Education, K through 12, higher ed, hospitals, $970 million. To give you an idea, just West Virginia, what that is a fifth, 1/5 of the entire revenue of the state. Absolutely, it is enormous. And on top of all that, $1.25 billion is sitting over to the other side in the CARES Act. And there's where we are able to help, our cities and counties and our small businesses and unemployment and so on to keep our taxes from going up and all the different things we can help over there. And in addition to that, there's a fourth stimulus on the way. I told you all this. I told you this. And really and truly, this is my wheelhouse. This is where I'm at my best. We really didn't need a whole lot of other assistance, even though we welcome any opinion in any way. But absolutely, I go back to just this. This is on the top of my briefing that I get every day. And it says, it's not time to panic. It's time to be cautious. It's not time to be fearful. It's time to be smart. It's not time to be weak. It's time to be West Virginia strong. That's exactly what we've done. And that's why, West Virginia, you are the miracle. I could never, ever be more proud of you. So keep it up, West Virginia. You're doing great. Thank you.